like to start by thanking the organizers and thanking all of you for having the fortitude to stay until the very end. Steve complained a little bit about being the 42nd speaker. I'm the 50th now, and I'm very happy not to be the 57th. So great. So so these are my disclosures. None of these are relevant to this presentation. So I'm going to shift gears a little bit. I'm going to talk about glaucoma. And glaucoma is a neurodegenerative disease, so it's related to the central nervous system in the brain. After all, the eye is an extension of the brain. And it's a serious health problem. There's a lot of patients that go blind from the disease worldwide and in the United States, and it disproportionately affects minorities. So what happens in glaucoma is that the optic nerve degenerates, and the optic nerve is made up of the axons of the retinal ganglion cells in the retina. So over time, these axons degenerate and the ganglion cells begin to die. And so patients start losing vision from the periphery towards the center. Eventually, about 25% of them will end up blind from the disease. Now, we've known for a number of years and through a large number of well-controlled clinical studies that intraocular pressure, the pressure inside the eye, is actually the main risk factor for the development and the progression of the disease. And it really accounts for about 50% of the damage. So, our lab focuses both on intraocular pressure elevation and what causes that, and we try to deal with that because that's the only way that we can treat glaucoma clinically at this point. But we also have been trying to understand what actually causes the neurodegeneration at the level of the optic nerve. And so we've tried to focus on the other 50% in that respect. So a few years, many years ago, actually about 15 years ago, we were one of the first groups that showed the involvement of complement in this process, and that complement upregulation was an early stage in the disease and preceded the development and the damage. More recently, we have shown that peripheral inflammation outside of the eye can actually affect the neurodegeneration. And in the central panel there, you see some images from the optic nerve head where there is increased number of microglia in optic nerve heads of animals that have actually spontaneous glaucoma but have also been exposed to lipopolysaccharide in the periphery, very far away from the eye at very low doses. Trying to understand whether this is relevant to our patients and why some patients progress despite good control of intraocular pressure, we looked at potential sources of chronic inflammation, and one of these sources that we all potentially have, and it's very prevalent disease, is periodontitis. So we looked at oral bacterial loads of patients with glaucoma and controls, and it turns out that patients with glaucoma have a higher load of oral bacteria. So, this work in the animals that I'm showing here was done originally with LPS from Salmonella. We went back and we redid the experiments with LPS from periodontal pathogens, and lo and behold, it's the same effect. If you expose animals to this LPS far away from the eye, they get worse pathology. We also tried to this in the middle panel there, we tried to make sure that what we detected as activated microglia, which is CD11b positive cells, are actually microglia, and it turns out that they are microglia. It's not infiltrated macrophages that have assumed characteristic of microglia. At least late in the process of the disease, when there's significant damage, it's not monocytes that have been infiltrated, it is actually microglia. Now, a couple of other groups have come up with data that suggests that the adaptive part of the immune system is also involved in this process. We haven't been able to replicate that data, but the data is out and is strong. What we focused on, again, is the role of periodontal pathogens. And so in collaboration with Dr. Quesavalu from the University of Florida in the dental school, we received specimens from animals that were either TLR2 or TLR4 negative, and so they don't have the receptors for lipopolysaccharide or lipoteichoic acid. And these animals were exposed to periodontal pathogens. There's a model of periodontitis, and interestingly, we actually could detect DNA of a number of these pathogens in the relevant tissues, in the retina and the optic nerve. We're not quite sure what that means. Are these bacteria able to cross the blood-retinal barrier at the level of the optic nerve? Is it just DNA that's circulating? Is it intact bacteria? This is something that we're looking into. So one of the things that we are actually focusing our current efforts is to understand the role of the vascular system and how the vascular system interacts with the immune system to actually potentially exacerbate the damage in glaucoma. So there are a number of clinical information that suggests that the vascular system does play a role in the pathogenesis of the disease. And there are, the capillaries in that area of the optic nerve are fenestrated, so potentially they could allow either pathogens or cells from the immune system to cross out and cause local inflammation in that area. And that's a topic of a study that we're conducting now as part of the pilot program at Downstate. And I will end here. I'll be happy to discuss in more details what we do and potential collaborations that may come out of this work or relevance to your work, wherever that may be. Thank you.
Thank you.